discuss a little bit in detail about reading part C. Okay, some of the like questions, I won't be like going into all the type of questions, but like, you know, there are different types of questions. So I would like to hear from you all, what kinds of questions have you all noted? Like what kinds of questions is like very common in part C?
Like suggestion, opinion,
Okay.
refer.
Yeah, suggestion, opinions, referrals, yeah, or something. Yeah,
Views, yeah, like concern,
pardon?
concern.
Some concern. Okay.
Yeah, that's main thing. Refer.
Research articles.
What is that?
A research article.
Yeah, research articles. Okay, but like what exactly are the type of questions? Because you will get 8 plus 8, 16 questions, isn't it? Like using to like from this two text. So what kinds of like what types of questions can you expect?
Like, what is the opinion about the writer?
What is, did you mean like what is the writer's opinion?
Yeah, right. In the first paragraph, what the writer feels
Okay,
about
writer's
the.
opinion, yeah.
And
Okay.
sometimes there will be like two words like idioms and this or that will be there. So they'll ask
Hmm.
about who it refers to,
Oh yeah,
what
that
it
is something
refers to.
related to the, yeah, vocabulary. Yeah, that's right. Okay, so these are the like some of the types of questions very common, commonly asked in the C part. Okay, so that is one is the opinions. It can be like the writer's opinion. Maybe somebody, the writer is mentioning some person or some researcher or some professor, whoever it is, and that person is being mentioned in that paragraph, and the question will be based on what that person thinks or what is that person's opinion. And sometimes, you know, there will be questions related to the purpose of some statement, or like why this statement was said, or why the writer has suggested this thing, or like, you know, just you to understand the purpose of some statements or some paragraphs. And there can be some questions related to the general idea, like, you know, that part C, actually, you compared to the part B, A and B, this part C is mostly like you need to identify the, you know, the general, you need to understand the general concept as well. Okay, sometimes some questions in such some cases, you know, you need to understand what exactly the writer is telling. Okay, because they might be discussing about some research studies, or they might be telling about some conclusions from the other studies, and giving their opinion as well, and also they will be, you know, commenting on what the other researchers have done. So you might need to get an idea like what exactly they are telling. Okay, and also there will be questions related to vocabulary and references. Vocabulary will be like, you know, like asking the pronouns, and you know, and some references is like some words, like if they give some words, and you know, they will ask what does that refer to in that paragraph. So you might need to so not necessarily you will be knowing all the like, you know, all the the meanings of all the words that is in the text, but you know, when you read the context, just try to guess. Okay, that is something, you know, you need to learn, because you know, as you carry on, like, you know, practicing the use the reading materials and all, then you'll be able to know understand a little bit, even though you don't actually know the complete or the full meaning of those words. Okay, that is these are the types of questions. And also this vocabulary reference questions, you will be you know, getting roughly around 2 questions per text. Okay, so it is like out of the 8 questions, it will be like 2 vocabulary or reference questions will be there for each the extract. So there will be total of about 4 questions. So there is an importance of, you know, kind of grammar, and you know, understanding the vocabulary, the meaning, and all those in the part C. Okay, now today we are going to look into some questions related to the opinion and facts. Okay, opinion, there will be some you know, some questions asking about what is the opinion of you know, sorry, Okay, yeah. So what is the opinion of the author? Okay, and in that case, you need to understand the language that is commonly used to identify what the the author is telling. Okay, so for example, you need to understand what exactly the facts are. Facts mean there will be some statements in the paragraph which will be supported by evidence, or some researchers have told that this is already proved, or like this studies show like these findings or something like that. That will be facts. But opinions will be the writer's viewpoint, or what the writer think about those that subjects, and it may not be having any evidence, or like any supportive backup will not be there. But no, it's just their idea or their opinion, their what they think about that topic. Okay, so this is how you have to differentiate the opinion and facts. And coming on to that little bit more, if when you get some questions related to that, okay, just try to ask yourself these questions when you are reading the paragraph. I'm not telling you to take some time to analyze all these questions, but no, when you get a question related to the opinion and facts, or something related to the writer's viewpoint, then you just ask, like, is it the writer's own viewpoint the question is asking about, or the paragraph is telling about just the writer's own point of view, or is it a neutral or in favor of an idea? Is the writer in favor of one particular idea, or is he just being neutral, like he's not supporting any idea, just like being neutral? Or is it someone else's point of view being reported by the writer for a reason? So sometimes this writer might be reporting other researchers, or other maybe somebody who have quoted some other thing related to this topic. So just understand what exactly they are telling. Then is it against an idea in the article? So while you're checking if it is a neutral statement, like a neutral opinion, or in favor of an idea, or also you have to check if it is against an idea. Okay, so these are the just general some general things you have to understand before you start doing this kind of opinion questions and all. Then now those kinds of language usage. Okay, so can you read this? This is a passage which is telling, okay, the question is, okay, so when you get a C part question, okay, part C question, so what will you do? The steps, what will you do first?
First, we have to count the how many paras are there.
Okay, yeah, good. Okay, that is one small tip that Sureka has now told. That is, just put like in the margin, no? Just put like 1 to 3, how many paragraphs are there. So if it is writing, so this question, for example, is asking, what point does the writer make in the third paragraph? So you don't have to again go back and count, sometimes it seems silly, but it's sometimes, you might need to, in that tension, you might be going back again, and then you might need to count again and come. So the first thing, that is very good technique to follow, is to just to number the paragraphs. Okay, then
Look for read the question carefully.
okay, read the question. That is a question stem. For example, that will be this one. Okay, so this one. Okay, what does the writer make in the third paragraph? What point does the writer make in the third paragraph? Okay, this is the question stem. Okay, yeah.
And read the options next.
No paragraph.
What was that?
Read the options, 4 options, or the para.
Okay, so what exactly will you do after just reading this question stem? What will you do?
I will read all the options once,
So you
and
will
then I
read
will
all the
go.
options. So in another, like any other way of doing, or are you all following the same?
No, I do question then paragraph.
So you just read the question stem and then go back and check read the text. Okay.
Yeah, then I come back the options. So I
Okay.
matching.
Good. Okay. Reshma.
Yeah, I'll read the stem and then come back to para. Otherwise, the options often make me confused.
Okay. Priya.
I will also come to read the paragraph and we'll go to the
Okay.
option.
Okay, what I think is like the practice which you have to follow is, this one. Just to read the question stem and then go back to the text. Okay, read and make sure that you read the paragraph first. Then at the second step, understand what it is telling, and then come back to the options. Okay, one by one, read the options, and then try to eliminate whichever is not related. And also, if you are eliminating one, or like if you are thinking A is the answer, then just try to make sure that all the other B, C, and D are not answers, because you need to find out why that is not going to be answers. That is like why before you eliminate, you need to understand, or you need to make sure that that is not being told in the paragraph exactly that way. Okay. For example, in this question, if we think, what point does the writer make in the third paragraph? So I just have taken this third paragraph here. So this is something asking about the writer's opinion, or the, like what is the writer telling in this paragraph? Okay, third paragraph. Okay, just read this paragraph. I don't know how many have you how many of you have already done this before? Have you all done this before? This paragraph, this question.
No, we have not. I have
No.
not done.
Not me.
Okay, maybe Navtej has done, isn't it?
Not remember.
Don't remember. That is okay. I know, because that folder, like I took this
Yeah.
question from that folder.
I don't remember actually, so that's why.
So, okay. So just I'll give you like, so for in part B, part C, you just should take only like about 1.5 minutes for each question. Okay. So try to practice like that as well, not spending too much time in one question. Okay. Now I'm going to give you 2 minutes to like, read and understand, and just tell me what will be the answer.
Okay.
Okay. So, have you found out the answer, or what do you think the answer would be?
A is answer.
A is the answer. Okay, so Priya is telling A is the answer. Okay.
Sureka.
Oh, sorry. Sureka is telling. Okay, so A is the answer. That's what you are thinking. Mhm. Mhm. Okay, any other answers, or are you just like, not able to make a decision?
C, ma'am.
Who told C?
Vimala.
Is it C, Vimala?
Yes, ma'am. I couldn't find any other.
Okay, you're thinking it is C.
I will go for D.
Yes, D. Reshma and Navdesh?
I think is I'm not sure, but D.
D. Okay, Kori D is Navdesh. Okay, yeah.
I'm still confused, was I go for D?
Okay, so Reshma is also like thinking might be D. Okay, so now we are going to check, like, okay.
So difficult.
Okay, what point does the writer make in the third paragraph? Okay, in this let's part C, you won't be getting like, exact the words, or no, there might be the vocabulary might have like a little bit changed, but the meaning will be almost like, that is similar to what is given in the option. Okay, in that scenario, like what, just think about the first one. The causes of isolation differ between US and Europe. Is it telling anything about the difference in US and Europe?
No.
Yes.
This is telling something
Yes,
about European study. That is
in European, the mental
telling
stress is
something
there.
about European
In
study, and there is a US study as well. But it is not telling anything. There is a difference, isn't it? No. So we can't take this. Okay, so this is not the answer. Okay. Next, okay, this was like related to A. Maybe we can tell it is like something related to A. Then more research has been done into social isolation than social integration.
no social isolation.
Telling anything related to that, like comparing two aspects, like, social research and the social integration. It is telling that, the social integration, you can see here, social integration is there, and also, social isolation, you can see somewhere like in this research has seen social isolation, but it is not telling that one, the social, or one, the more research is like social isolation. The research has been done like more related to social isolation. It is not telling like that. Are you all agreeing?
Yes.
Yeah.
Okay. Now comes the two other options, like, social integration assists in minimizing heart disease by altering nerve impulses. Okay. What do you
By
think?
altering cortisol.
Okay.
Was found to modify the physiological pathways. Maybe that would.
What is that?
Reducing the risk of cardiovascular disease. Last two lines, ma'am. Social integration was found to modify
physiological pathway, altering nerve
Okay.
impulses.
So there is something related to, because this question is something telling that social integration assists in minimizing heart disease by altering nerve impulses. Okay. So in this, it is telling the US study, social integration found to modify. Okay. Social integration found to modify. Okay. So that is found to modify. Okay. So you got a word like modify. There is a word like alter. Okay. Here. Alter is here. And in the question, like the option. Then comes the physiological pathways. Okay. Physiological pathways. Okay. There is nothing mentioned like a nerve impulse. Something related to that we can tell, but it is not that exactly that same thing. But anyway, that it is telling about reducing the risk of cardiovascular disease, isn't it?
Yes.
Okay. So I think we can find like something related to this option C is written here, isn't it? Something related to C is there. And then coming on to D, social isolation affects women while social integration has a greater effect on men. Okay, where is it telling like that? Exact kind of meaning.
The men also
No
had
no
just
exact meaning, but
Men and
the
women who
idea.
were
men
socially
and women
isolated.
socially isolated. Integration, the
Yeah.
studies fully in men.
Okay, the integration, this one, social integration, the studies, it is associated with something related to elderly men. Okay, and then there is something related to, socially isolated men and women. Okay, where socially isolated. So there is some like equal importance to social women and women who were socially isolated had this kind of problems. Okay, and then men had some higher cholesterol response only. That's not telling that because there was a greater effect on men. Okay. So what do you think? Like you have found like these points from the paragraph, and what conclusion are you coming to?
D.
C is the answer.
So Vimla is telling C. Then who else?
Sureka.
Okay.
Yeah, I think C is the answer.
Okay. Can you make out the answer there? Because it is not telling that, it is not telling this, there was like greater effect on men, this social integration. From where do you think this one? I want to make sure that, okay, that should be clarified. Okay, so let's see. Where is this, the C is telling, the D is telling social isolation affects women while social integration has a greater effect on men. So it is telling social integration has a greater effect on men. Which sentences do you relate to that?
Like the men also had a higher cholesterol response to
Okay.
stress.
Okay.
This ideas level.
Okay. So wait, I'm just trying to. Can't just make this. Let me just. Oh, okay. Okay. All right. So where did you? Where is it? So you're telling this one, isn't it? Okay. So you're telling this one. The men had some higher thing, isn't it? Higher cholesterol level. Is that the one?
Yeah.
Yeah. But if you just go back and check, it is related to social isolation.
Oh yeah.
Okay.
Social integration.
It
Yeah.
is not telling about social integration. Okay. But you can get something related to men in here, social integration, but it is related to just elderly men.
Yeah.
Okay. Can you make out how, why this C, this one, why D is not the answer?
Yeah, I can.
Yes.
Okay.
We need time to find out like this.
Yes, a little bit, yeah. But no, while you start practicing like this, practicing a little bit, and like try to practice like this, and I'm sure like you will be able to do it. Like in 2 minutes, maybe 1 or 2 questions. I will admit it might be difficult sometimes. We won't be able to understand, but no, almost like at least like it'll be like 1 or 2. I'm not telling it is always, but no, sometimes it might be difficult, or sometimes you won't get enough time to concentrate and read at the end. But when you follow like little bit, that the same kind of technique which we used in B, but a little bit more you need to understand. If you see that, okay, we just got 8 minutes. Okay, so if you just see this, let me just make you understand where exactly there is the answer is in the last part, but from the top itself you can understand, because the question is asking about what exactly this author is thinking about, isn't it? What point does the writer make? It is telling, you see, most recent studies, if you see, most recent studies have added to our understanding of pathways through which social isolation in this one influences physiological mechanisms to cause the disease. So answer is related to this as well. This is what the author is telling actually. Then after that, he's just quoting the studies which is supporting his statement. Okay.
Okay.
Okay, because the question is, what does the writer make? What point does the writer make in the third paragraph? And so this is what the main statement this author is telling. Okay, and then he's like quoting all the other studies to support his view. All right.
Like I thought that in European study there was something different, and US cross-sectional study there was something different. So why it can't be the first one? I thought that was the reason. But
Yes.
actually, I did not see the third answer properly. That is my mistake. But
Yeah. Okay.
this first one made me think like
Yes.
there are some difference between the studies, right? So it must be the answer, I thought.
All right. Okay. Okay. That is okay. So, like, just you need to like concentrate and read all the options and try to find out like which statements are related, which sentences are related to at least to each options, and try to, make a decision like which ones you can eliminate.
But
Okay.
in first option, the US studies never tell anything about isolation. Is
Yes,
that
that's
correct?
right. Yeah, that is telling about integration actually. Yeah.
And the third option, they didn't mention anything about nerve impulse in the whole
Yeah, that is the thing which
Modify
this
physiological pathways.
Physiological
Yeah.
pathways, nerve impulses. Maybe we can connect like
Yeah,
that.
we can connect like that.
Mm.
Okay, it is a little
Okay,
bit tricky actually, not like given directly.
Okay.
Okay.
It is like the 40 minutes time period is allocated for the earlier one, I guess, because exactly after 9:40 it
Yeah.
got connected.
Yeah, that is like, yeah, that is the 40-minute thing is there, but like I usually use the same, you all use the same link to join back, isn't it?
Yeah.
But,
Until then it was telling like you were in, the host has been in another meeting,
okay, okay,
but
okay.
now it was saying like waiting for the host to start.
Okay,
Yeah,
okay,
same thing. Yeah.
okay, all right, okay. I don't know, like, okay. Anyway, okay. So we will like continue doing our practice. I'm just going to check where I can find that now. Let's take this. Okay, so this was our first question. Okay, second one. Okay. 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 All right. So this is also something related to what the writer says. Okay, the writer says the Interheart study found that stress. Okay, it is telling those. So the question stem is that actually what exactly that means is like you want to find out what the writer is telling about this particular study, and this study is telling about the stress. Okay. Okay. So anyone
B.
got the answer?
B.
What is that?
B, ma'am.
Okay, Priya is thinking it is B. Okay. So B. Mhm. Any other options?
D.
Okay, Sureka is telling D. Okay.
I'm saying B.
What is it, Reshma?
B.
B. Okay.
B, ma'am. I can see. Vimala, it's B.
B. What do you think, Navdesh?
I'm confused.
Okay, confused. Like, what options do you think it can be? Like,
D.
okay,
I think
okay. So you're confused with
uh,
D and
D or C, like that.
D or C. Okay, so that
Yeah.
is what she's thinking. Okay, yeah. All right. Okay, so now we'll find out. Okay, so the writer says Interheart study found that stress. Okay, something related to stress. Okay, and now you went back and read the text, isn't it? And
Yes,
so you read the text and now come back again to the options. Is conditional on how much money a person earns. Is it telling something
Okay.
related to that?
No.
No.
It's telling something, okay? Okay, but it is telling, did you find something
Independent.
related to that? Because it is telling exactly
Yeah.
opposite of that.
Yeah, independent
It's
of
independent of so.
Yeah, the
Yes.
effect of stress was independent of socioeconomic status. So this is like, no, exactly the opposite. Okay. Okay, next.
I thought that this option is not there actually.
That is the thing. Okay, so you need to like at least something will be there. They will be there will be something mentioned related to those that option. Okay, each option. Okay. Okay. Now, can be affected by a person's level of social integration.
countries found that the presence of psychosocial stresses was associated with increased risk of acute. I just got it from that line.
So you thought this is from here.
That
Okay.
no, ma'am. It's across 52 countries found.
Oh yeah,
that the
there.
presence-
Okay. Presence of psychosocial stresses was associated with increased risk of myocardial infarction. So because you thought this psychosocial stresses.
Because next line they are telling these were still significant after adjusting for other cardiovascular risk factors. So I ruled out it's not D.
Okay, okay. Any other option? Because Reshma and Priya also thought the same answer. So did you get from the same sentence or?
No, I concluded from the whole paragraph. I couldn't find the exact same line or
Concluded from
anything.
the say, okay, all the whole paragraph. Okay. Reshma?
Yeah. I was also just, yeah.
Like, okay, you read
Got
each
the
paragraph
idea.
and made a decision like, okay, because
Yeah.
other options were not there. And so then you thought it can be, the meaning is something similar to that, isn't it? Okay.
Yes.
So then I want to ask Sureka, like, why did you think D was the option? Oh, no, no, okay, okay. So that is okay. So then coming to B, no, C, affects people from some nations more than others.
But they have not
It
mentioned like
occurred,
geographic regions and
yeah,
ages
occurred
in both
across
men.
all.
It is mentioned there. The opposite is like, I mean, since it
Yeah,
is
Yeah.
mentioned
independent
something,
of.
Now, if you read this sentence, the effect of stress was independent of, okay, this independent is like related to socioeconomic status and smoking, and then occurred across all geographical age regions and age group. Okay, so it is not telling something like, you know, some nations are, you know, affected more, like stress, they are affected with this stress. Okay, so this is not telling that. Okay, Navdesh,
Yeah, okay.
can you make out?
Yeah, I can understand now.
Okay, okay. Then now, is worse in people who already have health concerns. Where did you find that?
There was still significant after adjusting for other cardiovascular risk
There was
factors.
still, this was still
These
significant
are
after adjusting other cardiovascular risk factors. Okay.
Yeah,
He's
yeah.
not telling that, you know, this is getting worse in people who already have health concerns. Is it telling something like that? The presence of psychosocial stressors was associated with risk of increased risk of MI. But this was still, okay, this, you know, this was
that
still
this
significant.
denotes the stress, I think.
Yeah, it is related to the risk factors. They are not telling about the other health concerns, isn't it?
Okay.
Okay. Then where can we find exactly this answer? So what can be the answer? When you analyze like this, what can be the answer?
Be
So this having
First,
friends and participating socially
yeah,
Yes,
affects the
the answer is here actually. You know, because this is what the author is telling. Okay, this is the viewpoint of author. He's just telling, like, you know, and then he is writing all this after this that sentence to support his view. Okay, he's writing about this case study, this case control study, just to, you know, support his viewpoint. So what exactly is the first statement telling? Having
so
friends and families,
social life.
participating socially, see, can help to soften the stressors of life. Okay, so the B is telling can be affected by a person's level of social integration. See, so the social participation, how much the patient or the person is able to participate, or having like more friends will affect, you know, the person's the level of stress. Okay, can you
Okay.
make out?
Yes.
Okay.
Presence.
Okay, all right. So when you know, whenever you are getting, you know, when you're doing your practice sessions as well, when you don't get an answer, try to find out, no, why that answer went wrong and why the other option in the answer key is right. Okay, try to understand like that. Okay.
While doing group study, these questions were easy, but
When you get, yeah, that's what I'm telling. When you're doing by yourself, you need to do like this. Like, you need to take time, you know. Initially you might take a little bit more time, but, you know, try to first, you know, try in like first few practice sessions when you're doing at home, try to find out the answers. Okay, not concentrating on the time limit, but, you know, part A, you should concentrate on time and answers both. But B and C, you concentrate on how to, you know, how to approach each kind of questions and how you can find out the right answer. Okay, that skill you have to develop first, and then you need to go on to the, you know, time management. Okay, now coming on to this question. Okay, sorry, I need to drop all this. Okay, the next question. Okay, this is something very similar to the viewpoint. Okay, so this is asking in the fifth paragraph, the writer expresses the view that, okay, so his viewpoint. Okay. Okay. Right. I'll just give you 2 minutes to like go through.
I think the answer is C.
So, okay, so you think the answer is C. Okay, so Reshma thinks the answer is C.
Uh,
C is the answer.
Pardon?
I think C.
Okay.
for me is D. Responsible for most health problems.
Yeah.
Okay, A. What do you think, Vimla?
Confused between B and C, ma'am.
What is that?
Confused between B and C.
Okay, so you're thinking about either B or maybe C. Okay. All right, let's see. So the approach by the WHO is too simplistic. It's telling something about this A here, isn't it? Simple messages. Okay, and is understandable. Okay. Then people in low income areas have worse health. Okay, where is it telling something related to that?
Last line.
Last line.
The evidence that low
Okay,
birth weight and
so this one. Okay, the evidence that the low birth weight and genetic factors influence vulnerability to diabetes and cardiovascular disease is very relevant in low income settings. Have worse health. Okay, something related to low income. It is written here. So, okay, something related to B. Okay. Okay, yeah. Now, lifestyle factors are not the only cause of illness.
Lifestyle factors can also suggest, so they are not only there, something else is there.
Something else is there because that is telling, okay, another, the answer, the point is here. This sharp focus on lifestyle tends to keep other significant factors. So there are some other significant factors such as social participation in the shadows. So the focus on the lifestyle factors can also suggest that, okay, so this sentence is telling that there are other significant factors. Okay. So this is something related to C. Okay, now comes D. Irresponsible behavior causes most health problems.
So for their own behaviors and illnesses
Okay,
that
the
result
focus
from.
on lifestyle factors can also suggest that individuals are responsible for their own behaviors and illnesses that result from them.
Yeah.
Is it telling irresponsible behavior causes most health problems?
I Then
Just like
individual,
just
like I thought,
read
like
that sentence a little more, like with bit more concentration. The focus on lifestyle factors can also suggest that individuals are responsible for their own behaviors and illnesses that result from that behaviors, but irresponsible behavior causes most health problems. So we have found, like we have now assigned each option to either one or two sentences in the paragraph. So from this, which one do you think, like?
see,
What else?
see, yeah.
C. Who is telling? Vimla is telling C. Okay.
No, not this.
Oh yeah, I heard Navtej as well. I think Vimla also told, isn't it? Is it no?
Yes.
Sorry, my mistake. Okay, so that was Navtej. Okay. Yeah. So Navtej is thinking it is now it is B. Okay. So what is your opinion, Priya and Vimla?
I'm thinking why it's not
A
B.
also. Why it's not A, but it looks more of C answer.
No, what do you think it is more of A?
Priya is telling.
Yes, ma'am.
Okay,
More
simple
of A.
messages are effective for advocacy purposes. So the choice of WHO of this concept is understandable. However, okay, however, has got some importance there. This is what the author is telling. Okay, these messages are very, useful in telling, that they've got some advocacy purposes, but the sharp focus on this is giving more importance to lifestyle risk only.
Okay.
Okay, this word, as Reshma was telling, not always, but most of the time, this word has got some significance. Okay, in finding your answers. Okay, when they are, telling, they are telling. The author was telling something about the symbol messages and all. That was good. Author was telling, symbol messages are very effective and all. But he's telling there is a problem, or like he's telling what exactly he thinks.
Okay.
Okay. And then irresponsible behavior, why that will not come as an answer?
They're just telling about their own behaviors. They have not
Yeah, they
mentioned
are telling
an
that the
adjective.
individuals are responsible for their own behaviors, and that can result, and the illnesses that is caused by them. Okay, it is not telling that irresponsible behavior are causing the most of these health problems, isn't it?
Okay.
Okay,
Yeah.
so this is how you might think, I think somebody was telling when we were discussing the other questions, when we are doing it as a group, you are finding it easy because you are not just concentrating on one question. So that kind of concentration should be there. And also sometimes, there will be some confusion, like one or two will be the answer. That kind of confusion you can, that will get reduced while you start practicing daily, like daily you need to do one module, the whole set reading. Okay, because now the exams are nearing. Okay, all right, now next one. Okay, so I think we are moving on to a next session of next set of questions. So this is like third one we did, and then next is, okay, yeah, one more is there. Okay, this is something, okay, this is not the author's opinion, okay, but this question is asking about another person who is mentioned in the paragraph. Okay, so this doctor uses the expression settle the controversy to suggest there is something. Okay, so this is what he is suggesting using this this phrase. Okay, I'll just give you 2 minutes to think about the answer.
D.
A.
Okay, so Priya is thinking A. Okay.
I'm also thinking it is A. Reshma.
Priya is thinking A. What was Reshma telling?
A. I
Okay,
think so.
A.
For me is also A.
Okay, Pankaj is thinking A.
Because
A would be right.
Okay, Sureka is thinking A.
Yeah, ma.
Timla is also thinking A.
Hmm.
Okay, good. Okay. Towards like when we started practicing with, we are getting different answers. I'm not expecting like this will be achieved in 1 or 2 sessions, but maybe next week when we do, or next week, or towards the end of our sessions, we should be, you all should be having some, equal opinion, like the same answers, and that should be right as well. Okay, that is what is expected. And then let's see. Okay, so now we are going to start from D. Okay, misunderstanding about the methods used during his study. Is it telling anything related to that?
no about
No.
misunderstanding.
There was
Okay,
no
anything related to
misunderstanding.
his study?
No.
No, it is not telling anything about. So this is like not the option. A dispute over the findings from his last published research.
No, it's not written last published search.
It is nothing related to that, isn't it? It is not actually telling about
Last research.
there's something that is told us like this author, lead author. It's just telling lead author. It is okay. Yeah. Okay. So according to research and okay, so this is something telling that this meta-analytic review was done by maybe this person. It's not that clear, but okay, we can assume that. But a dispute over the findings from his latest published research. Is it related to the dispute related to that research finding?
Mm.
No, both were saying the same thing, so there was no any dispute.
Okay, yeah. Then confusion over the terms used to define cardiovascular disease.
They are
There is
telling the risk factors. They call it.
Actually, initially I thought this B would be right because
Which
they
one?
settled the confusion between the two, I thought. But used to define cardiovascular, they are not talking about the cardiovascular.
Yes, they are not
they're
telling something
talking,
related to defining cardiovascular disease.
yeah, they are telling about multivitamin supplements
Yes,
use.
they are telling about the multivitamin and mineral supplements, and it is written here, cardiovascular is right there, and also to prevent cardiovascular related to this supplement intake. But it is not telling about, there is no confusion related to the definition actually. Okay. So then all the three are you have eliminated and then you have reached here. Okay. From which sentence you can find this answer?
Like in the first sentence, they have the they are telling about his study is telling that a meta-analytic review there's no effect of MVM on the cardiovascular, and the author is also telling there's no evidence, so there is a lack of agreement between the both.
Okay. Any other idea like how you all landed in that answer?
I didn't
The
exactly
difficult
landed
to
on that answer, but I just tried to strike off the other three, and
Other
I
three,
could.
and you just okay.
Yes.
It has been exceptionally difficult to convince people.
Yes, it has been especially convinced people, including the nutritionists, to acknowledge this. Supplements do not prevent cardiovascular disease. So this is the thing he was trying to tell using his research. Okay, these supplements will not prevent cardiovascular disease. a lack of agreement about the efficacy of this one. But when you see, initial statement is telling taking this supplements does not prevent myocardial infarction. Okay, and then, sorry. This is, okay. Oops. Okay. So this is actually in that statement. It is telling, okay. So this is not preventing this myocardial infarction, and also this this Kim is telling there is no evidence in this one. So, and it is very hard to convince people, okay, including the nutritional researchers, to acknowledge that this will not prevent cardiovascular disease. So you can, again, it is clear from that last statement as well, these nutritional researchers are telling that this will help cardiovascular diseases, prevent cardiovascular diseases, but it is not actually the case. That is what he's making that statement. Okay.
Yeah.
Okay. All right. Okay. So that is about that question. I think we did only 3-4 questions, isn't it? Okay. So now this one. Okay. To clear all this. Okay. Okay. Now this one. Okay. This is something related to. Okay. Quickly try to find the answer, because the session will get over soon in 8 minutes. Okay. So the writer suggests the package developed by the WHO. Okay. Okay. Have you found the answers?
C.
Okay. Yeah, I was thinking it is C.
A.
What is thinking? A.
I think it is C.
Pardon?
C by
C.
Reshma.
Okay.
I think D.
Sureka is saying D.
D is.
C, ma'am.
Pardon? Is it D or
C,
A,
C,
Vimla? I
ma'am.
couldn't
C.
hear actually.
C, ma'am.
C.
Yeah.
Okay, yeah. All right. Okay. So let's see. Okay. First one. Okay. Has a strong focus on saving money.
Cost-effective intervention.
Is it
It's
just
WHO to improve
Something.
to cost-effective intervention and source.
okay? So this was something related to here. Something cost is here. So it can be A is here. Okay. The package of non-essential, non-communicable disease interventions for primary healthcare in low resource settings was developed by WHO to improve access to cost-effective interventions.
Yeah.
Okay, this is telling that because they have developed this, package they will be able to access more, cost-effective interventions. It is not telling actually that, it is telling something related to cost, but it is not really telling that the focus is on money saving money. Okay, just read it maybe 1 or 2 times again, so that you will be able to make out the difference. Then, encourages elderly people to take responsibility for their lives. Where is that?
Not mentioned
They
about.
are more likely to seek health care.
There will be something mentioned. Okay, encourage elderly people to take responsibility for their lives. Elderly people?
Older people are more
that is
likely to be
older people.
motivated
So that
to
is something
change.
related to be. Then more likely to be motivated to change behaviors that jeopardize their health, such as, to maintain. Okay, but it is not telling they are more likely to seek healthcare and to have better self-care in the management of their condition. It is not telling they are going to be taking the responsibility. It is telling they are going to seek health and healthcare and some other Okay, so this is not going to be the answer. Then fails to acknowledge dangers beyond lifestyle choices and eating habits. Where did you get that answer from?
It addresses the risk factors, these and these and these. The package doesn't include.
Okay, so this is related to something here, isn't it? Lifestyle choices. And okay, so this statement is telling this does not include strategies to encourage social participation. So it is telling the other factors are here, which is included in the package. Okay, so this is something related to C. Then carefully balance a range of issues that impact on an individual's well-being. Carefully balances.
With that only, that it has a range of issues, right?
Yes.
Risk factors. So, but eating habits are being told in that addressing. So C will not be right. They are telling
what is that, Surekha?
In C, they are telling about the eating habits or they fail to acknowledge eating habits, but eating habits have been addressed.
What exactly it is telling is see, fails to acknowledge dangers beyond lifestyle. So it is telling these lifestyle choices and eating habits are mentioned, but not beyond these.
Oh, I thought it is. Yeah.
Okay, this beyond is there. So it is just telling that this package is not mentioning beyond this lifestyle choices and eating habits. It's not. It is not. They are telling. It is only mentioning these two. That is the actually meaning of that.
I got it.
Okay. Carefully balances a range of issues. Okay. Oh, less than a minute. It gets cut off. Impact on an individual's well-being. I don't think this will not be the answer, because they are not taking consideration this social participation and all. So they are not balancing a range of issues. They are not balancing it.
Okay.
Okay. Are you able to understand?
Yes, I got the point. I didn't realize the